doing our presentation on gastric cancer. Okay, so before we get into the cancer part of it, we can just do an overview, a little quick overview of the gastrointestinal system. So, as you see, the basic function of the gastrointestinal system is to alter chemical and physical composition of your food so it can be absorbed and used by your body. So, in order for that function to do what it needs to do, it depends upon secretions from your endocrine and your exocrine glands that control the movement of ingested food through your tract so that your body can properly absorb it. So, of course, the gastrointestinal tract plays a major role in digestion, and we also provided a model for y'all to look at also. It begins in the mouth with chewing and swallowing to break down the food, and then it continues into your stomach with the churning movement of your gastric contents that have become mixed with acid and enzymes to further break the food down. So the greatest amount of digestion occurs in the first part of the small bowel, which is the duodenum, as you can see on the model. And in addition to the secretions that's already coming from the intestines, enzymes from the pancreas and the liver is going to enhance digestion. So the pancreas secretes enzymes for the digestion of the proteins, fats, and carbohydrates that you're taking in. And it also secretes a solution to kind of neutralize it while it's going through your stomach. And bile is secreted by the liver and is stored in the gallbladder and it enters the duodenum through the common bile duct. So bile kind of acts like a soap and it disperses in small forms and to mix it with the waste. So when all of the digestion is complete and it's completely exits your stomach and your intestines and whatnot, your nutrients are absorbed into the body, and if you're moving too slow through your colon, it can cause constipation, but if it's moving too fast, then that's whenever diarrhea comes into play. So basically, whatever material is left over is what's secreted as feces. And here is a radiographic demonstration of the GI tract. So normally plain abdominal radiographs and contrast studies of the GI tract are what is ordered by the doctor. And it also requires that you have to change your technical factors whenever you're imaging the GI system.
Okay, now that we've done a brief overview of the gastrointestinal system, let's talk about what exactly gastric cancer is. So gastric cancer is also known as stomach cancer, if you haven't heard it from gastric already. It's not a condition where a buildup of abnormal cells form a mass on the stomach. So that you can kind of see this in our little model right here, the black dot, that's going to be the gastric cancer. So it is the fifth most common cancer worldwide, leading to death in the world right now. And what are the effects? Gastric cancer can be difficult to diagnose early on because the symptoms are not very specific to gastric cancer. They're kind of like common symptoms such as heartburn, feeling full, frequent burping, vomiting, stomach ache, and that stuff that is kind of common, so it doesn't pinpoint directly to gastric cancer. So that is why it's normally diagnosed in the advanced stages, like stage 3. Some of the late effects that are more specific to gastric cancer include pleural effusions, obstruction of the gastric outlet, gastroesophageal function or the small bowel, bleeding in the stomach, and intrahepatic or extrahepatic jaundice. It is diagnosed into 4 different stages, stage 1, 2, and 3, okay? So stage 1 being the least aggressive, stage 4 being the most aggressive. And the stages are based upon location and whether any lymph nodes are involved and how deep it is through the stomach layers. Stage 1 is the intraluminal mass without any mass thickening. Stage 2, some wall thickening starts that is greater than 1 centimeter. And then that is without invasion of other tissues. Stage 3, wall thickness, and it invades other tissues and adjacent organs. And stage 4, it spreads to distal sites. So once you get to like stage 3, the 5-year survival rate actually decreases dramatically to 18% versus 94 to 82% for stage 1.
Okay, so doctors can use various imaging modalities to diagnose and stage gastric cancer. Of those modalities, they use barium swallow or upper GI series, endoscopic ultrasound, CT, and MRI. Some common features of gastric cancer is tumor infiltration of the gastric wall, which is thickening, narrowing, and fixation. Large irregular polypoid mass. Can't even say that. So irregularity and ulceration within the mass suggests malignancy. And then ulcerations, which varies from shallow erosions and superficial mucosal lesions to huge excavations within fungating polypoid masses. So on your upper GI series, this allows visibility of the inner lining of the esophagus, stomach, and first part of the small intestine. It's used to look for early stomach cancer and will outline any abnormalities in the stomach lining. Upper endoscopy is the main test used to find stomach cancer. It also allows visibility of the lining of the esophagus, stomach, and first part of the small intestine. But unlike upper GI, it also allows the doctor to take a biopsy during the test. Through endoscope, stomach cancer can look like an ulcer, a mushroom-shaped protruding mass, or diffuse, flat, thickened areas of mucosa. Endoscopic ultrasound is the most useful in seeing how far cancer may have spread into the wall of the stomach, to nearby tissues, and to nearby lymph nodes. It can also be used to help guide a needle into an area for a tissue sample for biopsies. On this image, it's showing the tumor infiltration through the serosa, which is the arrows, and the arrowheads are showing enlarged perigastric lymph nodes. So CT and MRI can show the stomach clearly and confirm location and the extent or staging of cancer. It can also show the surrounding organs and lymph nodes to determine if the cancer has spread. So on this CT image, it's showing thickening of the mucosal enhancement of the lesser curvature of the stomach